the vision of what we're trying to get done here is to find cancers early where we think we can identify, isolate, and intervene largely through surgery.
The Symposium is an event that we've been holding for the past 10 years. It's an event that brings together all of the Canary Foundation network. So these are clinicians and basic researchers, physicians, physicists, chemists, biologists, anyone who's working on the problem of early detection in cancer.
Most of these tumors take a very long time to develop, so we've got an opportunity to intervene.
Instead of waiting for the tumor to grow, we force the tumor to produce artificial biomarkers and to reveal themselves. So imagine that you could take a pill and then a day later or so collect some of your blood and then see if there's a cancer hiding somewhere in your body.
We believe very strongly that the unit of disease is really the single cell, and that we can learn an enormous amount from these single cells.
I think lung cancer screening is going to transform lung cancer care. Screening with low-dose CT can reduce lung cancer mortality by 20%.
While our core understanding of the biology of cancer has improved, the technological underpinnings of stuff to measure it and find it has moved at an incredible rate.
If we get them in the same room and then we get them thinking about the same problem, that's sort of where the magic happens. It's a little bit different than conference calls and emailing. It's when you're in the same room and putting heads together is when the magic seems to happen.
What we need to do is have something that not only elevates early, but is actually either unique only to tumors, one tumor type, or you have to have imaging.
If the photoacoustic stuff works as well as we hope it does, it really unlocks this vision because I think it reduces the bar on how good that first test has to be for the doc. We're going to move ourselves over to the wine and trees.
Judges will be coming around to your posters during the poster session.
We have in excess of 45 posters in the competition. We have 3 different categories.
We'll have dinner, we'll have a short awards ceremony.
We didn't know if the problem was tractable. The problem is tractable. We didn't know if molecular imaging was going to have the performance to really make a difference in low-cost environments. We know that's the case. We weren't sure whether underlying technologies could actually get sensitive enough. No-brainer. We've got one big problem left to crack, right? Which is how do we find and understand the biology to get these biomarkers or biomarker panels to get this done.